I just want to say, you guys are doing a great thing. It's such an uncomfortable topic to talk about, especially for a guy, young guys in their early 20s. And, I'm glad that, I could tune in and, listen to you guys.
Spencer Kobren's The Bald Truth.
It's funny, Joseph. Every time that opening starts, I'm like, what are we still doing here? It's like it's a mix of I always loved the fact that I've been able to take this over from the radio. That opening is so ancient. Essentially, I have two openings, and it kind of reminds me.
Good, though.
Yeah, I mean it's reminiscent of my youth. And when this program was, kicking ass nationally, and it was like this weird phenomenon that, the press was picking up. It was like this weird balding guy talking about hair loss on national radio, and people were calling in, giving me their sob stories. And now, while I still have that feeling, it's kind of like maybe I should be doing something else at this stage in my life.
I mean, you're almost 60.
Yeah, exactly.
As Rob Hellner reminds us in the chat room.
Yeah.
Yeah.
So, I mean, I did a live yesterday on Instagram, just impromptu live broadcast.
I saw.
And I was kind of being distracted. People were knocking on my door. I had Instacart delivery that was mixed up, and they were like, Mr. Kobren, I think you got the wrong package. I'm like, I'm working.
That's what she said.
Yeah. But it is interesting, the different types of calls in general that I get from Instagram compared to the guys who were calling from your channel.
Mm-hmm.
And I'm not saying there's
you tend to be a bit more educated.
Well, there's a level of sophistication, I would say, from your channel that you don't see in general from Instagram, except yesterday was a unique situation because I did have a young caller, 27 years old, who is considering strip surgery, which is wild anytime I hear a young guy talking about strip. And it was really based on all the information that he was able to glean from what we do and what I've been posting about on Instagram. And while he's young, he has stabilized his hair loss with the use of medication. So he's had success with no adverse side effects. And he's also not rushing into it. But he had questions about whether or not he should be doing FUE or FUT, why he's considering FUT, number of grafts that would be average for a strip procedure, and all, just good questions. And he's still not in a rush and doesn't sound super desperate to have surgery. While it would make him happier to have a fuller head of hair, he also understands that even at his age, he would want something that's conservative. So I would say out of most of the calls that I get from the Instagram Lives, that was one of the more well-informed callers. But a lot of the kids, sadly, are still asking about, castor oil.
Yeah.
I say a lot of the kids. What was that?
The old standbys.
Yeah. Jesus, I really should invest in the iron. I think, what's his name is right? FSK.
See, I didn't even notice it until you brought it up.
I just don't have the patience. I kind of figure, who am I going to impress? Honestly.
Well, it's a bunch of guys anyway. No offense to our audience, but we're a bunch of guys. I don't care if someone I'm watching, if Rogan went on with a button-up shirt, he always wears T-shirts.
Yeah.
If a little bit of it was wrinkled, I wouldn't give a shit.
I'm going to tell you a little.
Joe. He's just hanging out and talking to us.
A little secret about me that is maybe an oddity, not an oddity, but a weird thing. Why I don't wear T-shirts on the program. I kind of find that it kind of. I don't know. I just think that a collared shirt gives you a little bit more of a you're respecting your program type of thing. I don't know why. That's just me. And also, I always think it's weird for guys who have a little muscle, who are grown men, to like wear these tight shirts that show their muscles, like the Brits do. You know what I mean?
All two of them.
Yeah, but there's a lot of, for some reason in England, these kids and adults wear these super tight T-shirts. Now, Joe Rogan is an exception because his whole world is fitness, training, athletics,
of course.
All that stuff. And I'm not saying I'm even close to what Joe Rogan looks like as far as muscularity. And but I'd probably get a little closer if I was on some gear, which I'd like to be at some point. But besides that, I just kind of think it's kind of weird for an older guy, even if you're not old, like even 45 or over, to be sitting here doing a podcast in a T-shirt. I don't know why. Maybe I'm wrong. You guys can let me know in the chat. Because if you want, I'll start wearing T-shirts. Or even better, wife beaters.
Look, the way I look at it, as long as your chest and upper arms are covered, your delts, I'm fine with it. T-shirt, I have no problem with T-shirts. What I don't like is taking it further, the wife beaters and then the Andrew Tate look where he's sitting there, all he's got, from only thing you see on the head and torso down is a cigar.
Yeah.
Not that I watch the guy, but clips I've seen online, when I'm scrolling my feed, it's like, really?
Honestly,
come on.
When it comes to him, he's got his own gig, and I know that it's politically incorrect to, I guess, speak about him even in a positive light in any way because of everything that's going down, whatever. He has his own gig. He's made his own way online, and it's something that really attracts a younger audience. And, I don't know the reality of his situation and what's going down with his legal issues and all this stuff, but the guy's got a lot of good points about a lot of interesting points about a lot of things and some good points.
I've not listened to him enough to know. I'll take your word for it.
And he's jacked. He's got a lot of tattoos that he wants to show off.
Is he actually jacked?
Yeah,
I don't know.
He's pretty built.
Is it jacked or he just doesn't have much body fat?
No, he's jacked. That guy's jacked.
Okay. I know he used to fight.
His guy is jacked, like not like a bodybuilder jacked, but like jacked like a fighter, like an athlete.
Yeah.
I mean, it's impressive. All right, guys, the phone number, 888-659-3727. We're doing a radio show here, guys, a fucking call-in show. That's why we're here. I'm not just here to talk into a microphone. I'm almost 60.
You got them all mesmerized. I'm almost 60. You get them all mesmerized with your opening monologue that they forget that there's a number in the bottom right-hand corner of their screen that they can use this thing called a telephone. Is it even called a telephone anymore? Their phone to dial. And then there are little voices on the other end that just happen to be us.
Is it even dialing anymore?
What else do they call it?
I don't know. It's just there's no dials.
Calling. Good point. I didn't think about that. It's not a dial anymore. It's a touchpad.
Yeah.
It's not even a pad. It's just tapping the numbers. Whatever.
Dude, I grew up.
Yeah.
There was a phone in the kitchen with a really long cord. If I wanted to speak in private, I had to bring that phone into the bathroom. And then there's a party line, and my father would pick up to tell me to get the fuck off the phone already. Like I was a little girl.
We had a party line where our neighbors could pick up and listen to our conversation.
Yeah, I mean, that was an extension. Yeah, we had party lines too.
Based on the number of rings and how it would ring, you knew if it was for you or for your one of our 1 to 4 neighbors up not even the street, up the road.
Yeah.
Yeah, 1980s technology in the mountains, baby. But let's talk about the hair pharma lie. This stems from an article you sent to me, which inspired the title of today's show about. Can't really call it big pharma. Maybe you can call it big pharma because like Hims is a multi-billion-dollar company now. So yeah, the big pharma hair lie. That's what I should have called it. Tell us about it, Spencer.
Well, here's the bottom line, which I think is a very interesting loophole, and it is why you're able to see all of these drugs in your feeds from companies like Hims and Keeps and Roe and all these different brands that are selling not only combination hair loss products, but erectile dysfunction drugs to kids who don't have erectile dysfunction but just want to party really well. Mm-hmm. And other mashup types of drugs without listing adverse side effects. That's a loophole that no one really discussed. Now, I think this was a good article from the Wall Street Journal as far as at least providing that information to readers, because no one really thinks of that. Now, of course, I think of it. And one of the main reasons that I was not able to get involved with one of the bigger companies was, besides not providing full transparency to me, just willing to write a check for to carry the IP. I always felt that it was really important for during the consultation to ensure that patients had full disclosure, even before entering the consultation, something to read about the adverse side effects. Even before you got to that point where you were consulting with the telehealth doctor who doesn't, sadly, know much about hair loss in general. I'm not talking about any specific company, but let's put it this way. I was offered a situation where I could have had my own company, my own startup, and essentially the way that it works is you hire an outside company that does all of the consulting. They have the doctors. It's an amazing process. It's like having a 900 number or some shit. Mm-hmm. You know?
Okay.
So you just work with this company, they get a piece, and then you work with the right advertisers, they get a piece. You could put your own product together, white label it, they get a piece, and then I would get a piece. And I would not have to worry about shipping or any of that shit. And my response was...
Sign me up.
My response was, wait till I'm 62. No, my response was, I appreciate the opportunity. I know that the brand would kill carrying the American Hair Loss Association seal. It's not a bad idea for my future and for the future of my family to have equity in a company like this. Currently, Hims does about $7.8 billion a year in business, which ain't too shabby.
Nothing to shake a stick at.
But if I get involved in this capacity, no matter how easy it is, even if I had access to seeing where the drugs come from, the truth of the matter is I'm not really going to know unless we're able to do audits consistently. Yeah. And when I was speaking to these people, they didn't like the idea of us giving them access to the side effects right away. So that really turned me off. They're like, well, that's something that the doctor should discuss. And I'm like, these are barely doctors.
But in some cases, they're not even seeing a doctor.
No, they are not seeing. They're not seeing a doctor. They are either having an online consultation in writing, or sometimes it's an actual telehealth video call.
Yeah.
And there's different price ranges if I want to get involved with that. So it's a very interesting model. And there's a loophole when you're dealing with compounded medications and you're not an actual pharmaceutical company where you do not have to list the adverse side effects. So these companies are now selling these, generic Ozempic and Wegovy products, but not even discussing side effects on their TV ads. And no one seems to notice. The consumer isn't cognizant enough to notice, wait a second. When I see this high blood pressure medication, half the commercial is telling me that I'm going to, have projectile vomiting and anal bleeding.
Yeah.
And
that's just from looking at the box.
Yeah. That's just looking at the black box warning. How come these companies don't have to do that? So, long story short, the Wall Street Journal wrote an article which honestly was not balanced. Listen, I've been doing this for a long time. I've never seen a truly balanced hair loss or hair article ever, except for one. It was written in, I think, 2008, the Atlanta Star-Constitution. Is that the name? The Atlanta Journal Constitution. Yep. Atlanta Star-Journal, yeah, whatever. Great article. The only one ever. So this was really an article that was geared towards really focusing on the younger guys who've had adverse side effects from companies using finasteride products from companies like Keeps and Hims. Focusing on a handful of patients who said that they were unaware of these side effects. Then speaking to a urologist, I think at Cedars-Sinai, who's saying that these are dangerous drugs, essentially, and that young men shouldn't be taking them, and that the side effects are very, very common. And I find that to be very unbalanced, because the reality is maybe in his urological practice, the side effects are very common because he's seeing one or two patients coming in every month or every week or whatever he said. But it's kind of like going to one of these propecia sites, anti-propecia sites, just like Erwig did, and just interviewing these patients and claiming that it's a study. So
that's one of my favorite ones.
Yeah. So I mean, overall, I think it was a very unbalanced, and it will strike even more fear into some patients. However, I do think that some of the information was very important and stuff that patients just have no idea about. And that's why I have concerns about these prescription subscription formats, these telehealth companies selling these generic drugs and then combining these drugs even into these mashup formulations, and there's no regulation. There's some regulation when it comes to the compounding pharmacies themselves, but that's kind of sketchy as well.
And my question is, has anyone actually taken the time to see what combining these different medications do as far as creating new side effects or amplifying already known side effects? Like this is completely uncharted territory. When you have one pill that fixes your hair loss, fixes your limp dick syndrome, fixes your depression about having either, and helps you lose weight. Like, if they're not combining all of them now, they will be. And what is the combined effect or the new effect that something like that creates?
Yeah.
I'd like to see that study.
I have no idea. Now, people are going to say, well, if you can take the drugs separately, why can't you mash them up? Why can't you compound them? We don't know why you can't.
There's this thing called drug interaction.
Because
there's this thing called drug interaction.
Well, there's
finasteride has no known drug interactions, but I don't know about the other ones.
Well, that's true. But I'm saying it's just the hair loss drugs themselves. People are going to say, well, if people are going to take oral minoxidil and finasteride, why can't you take a combination in one pill? We really don't know. We don't know what the molecular structure and the changes and the things that need to be used to bind these drugs, how it's going to affect anybody. We don't know if that's going to exacerbate side effects.
Yeah. I
can tell you that, and it could be just based on volume, since these companies have been in play since about 2017 or so, I would say that the side effect profile or the complaints about side effects from generics or compounded drugs have gone through the roof. Now, that's probably based on pure volume being sold, or is it? I don't know.
Yeah.
Now, like I said, there's a startup company that is going to be coming online soon that we may be providing our IP for. And if we do that, that will be the company that eclipses all other companies. And I'm not saying that to be obnoxious. It's just, any consumer in their right mind, if they have the opportunity, say it's a dental product, to purchase something that has the seal of the American Dental Association and doesn't, they automatically will gravitate towards that seal. That's just the nature of the game. But in our particular case, if this company could come through, provide us full disclosure on a regular basis, give us the right to audit, like they claim they are, their facilities on a regular basis. Let us know when or if they change out their generic products, or if even something as simple as a filler on a regular basis, then I'm good with that. You know? I mean, hopefully the drugs are coming from Europe. That's what, I think is going to be happening from everything that I understand. And again, we have not signed on the dotted line for this at this point, but it's getting close. And I just want people to have access to something that's good, something that's consistent. And, but you all know my feelings. My feelings go for the brand name first. But that's not what people are doing.
Brand whores.
Yeah, that's not what people are doing. So, the way that I see it is, okay, these companies are applying to be part of our trusted brand program. Let's work with a company that can actually provide something that can be trusted. But I'll still say, and this company knows this, I'm sticking a brand. I'm not all of a sudden going to be bopping around with a bottle of this product saying that I'm taking it, because that's not going to happen.
You're really making it easy for people to come to you with brand deals.
That's just the reality.
Kobren just said he won't ever endorse any product he's endorsing.
Yeah.
Let's sign him up.
That's probably my downfall in business. But the reality,
give me a pin. Stat.
The reality is there are smart enough people who see that and they're like, all right, this guy's telling these kids the truth, and he's willing to possibly give us, provide us with his IP to say that at least our brand is the best in this category. The problem is when you see these influencers, a lot of them, as soon as they make a brand deal, they're using that product because that's what they're getting paid to do.
Of course.
Don't F with my ProScar. It's 30 years. What do you think? I'm crazy?
It's happened once already. They changed it. They spun off a subsidiary and let them make it. That's
true.
It's not Merck anymore.
That's true.
That was a scary day.
But I'll tell you, it was a scary day. But that's true. But the facilities are in Italy, and it was already, to my knowledge, one of the companies that they were working with manufacturing the drug anyway.
Yes.
So, and we know it's their formula. It's the exact same pill. So that's been good. What was scary is that not too long ago, and I don't know if they started shipping yet, they weren't shipping ProScar or brand name Propecia. Drugstores couldn't get it. For like 3 months, it was on back order.
Yeah.
So I don't know what's happening in the EU with that regulation issue or whatever. I think it's back on track now. I think there was just some sort of a supply issue. But I was like, holy shit. And I found the guy who was able to get me a bottle of 100, by the way, as a backup.
Nice.
And I just saved this stuff. People think it expired. It doesn't expire. It should have lasted you decades if you keep it sealed.
Yeah. And out of the light.
Yeah.
It's light sensitive.
So I have my antibiotics, my dewormer. I have, my I have my ProScar. I have all the shit that I need, generators. I have a lifetime supply of Derm Match. I mean, let me tell you something. Armageddon hits, my hair's going to still look good.
That's what matters.
Yeah.
Dante in the chat room says he just got name brand ProScar without having to wait.
Oh, that's great. That's good news, brother.
Good stuff.
That's good news. All right, so we're not getting any phone calls, so we're going to call it a night. Thank you so
me.
much.
That was a great ramble, though. That was a great monologue. It was informative. It was entertaining. I laughed. I cried. It was even better than Cats. Well done.
I can do Cats. Guys, call in 888-659-3727. What the fuck is going on?
Well, we got Welfare Leech in the chat room. He wants to know what our opinion is on stem cell and PRP for hair regrowth. He's already had 5 hair transplants.
No.
He lives
Why are you
in South Korea. No, I'm not answering anything. I'm just saying these are the questions he has, and they are very good questions to be asking on the phone directly to us, so we can hear your voice and you can hear our answers. We can actually interact. A little bit of give, a little bit of take.
That's the whole point. That's why we even do this. We want people to be able to listen. You know, it's funny, when I do the Instagram Lives, it's very slow initially, and then once we get a phone call, then all of a sudden the numbers just creep up because people are interested.
You know,
they're like, what the hell is this?
Because everyone else is like, I can talk to this guy?
Yeah.
He can actually answer my questions. I don't have to DM. I'm down.
The phones are ringing. They're lighting up. Guys, if you get a busy signal, if you get a voicemail, that means that the phone lines are busy. I have not fixed that in 8 years. And honestly, I have no motivation to unless we're constantly getting calls. But we do have all lines lit right now, so let's see who this is. Hey, you're on the air. Who's this and where are you calling from? Hey, caller, what's up? All right. Hey, you're on the air. Who's this and where are you calling from?
Hey, Spencer, this is Ethan from Nashville. How are you?
Ethan, brother, how are you, brother? He called.
Good,
Ethan called live yesterday, and he's like really the guy that kept the show alive. Thank you for that.
He's back for more.
Of course. Yeah, I'm back for more. I in the call yesterday, Spencer, we had talked about the scalp exercises to increase the laxity in the back of the scalp, and you had mentioned that.
Brother, I was stoned yesterday. I was kidding about that.
Yeah.
No, Joe's the man to speak to, for sure.
Perfect. Well, I just didn't know if Joe could point me in the right direction as to where to get those resources for those scalp exercises.
Are you watching right now?
I am not watching right now, no.
Because if you actually had us on screen in front of you, I could show you live how to do them.
Okay, give me 1 moment here.
Okay, all right. But so you're talking about FUT. Where are you talking about going to have it?
I've done a few different consults in a few different locations. 2 in-person consultations and 2 in-person consultations, 1 in Chicago, 1 in Atlanta, and then I've had a virtual consultation in Florida, the doctor in Florida. Okay. And they've all been IA, HRS doctors, and they've all been very impressive. Good. I'm just sitting on the fence as to, where I want to go and who I feel most comfortable with.
Okay. All right. Good to know. Yeah, I mean, it makes sense. Let me know when you can see me on screen, and be sure to have your volume down so that there's no feedback. And I'll be glad to walk you through it live here on The Bald Truth, which is the only place you can get something like this, by the way. Just saying.
Yep. The only place where you can get this action. Yeah.
Exactly.
This guy is such a ham. He turns into Jim Carrey. So just, you're going to have to indulge him, Ethan.
All righty then. Anyway.
I've got you pulled up on YouTube here, but I'm getting audio from the YouTube feed and from the call, so it's a little nauseating.
I just told you to turn it down. You got to turn down that volume. Just make it. Just turn it off. Turn off.
Oh, you mean you're on YouTube on your phone?
Correct. I'm on my phone here.
Oh. Okay. Well, you'll see this you can see this in the playback. Okay, so scalp stretching exercises. It's pretty simple, but a lot of people may not understand the full concept behind it. So it's not just like stretching your scalp. It's actually pressing in and then stretching your scalp, because you're not just stretching your skin tissue. You're also manipulating the gallia, which is below the skin tissue, right? And it's also great for working your deltoids and your biceps and your triceps. Okay, so it's very simple. You just get the base of each palm, all right, and moving up from the top of your ears, you go maybe an inch or two, all right, and so you start you find that spot there, and then you don't interrupt me, Spencer. I hear you.
I'm about to, man. It seems so
exactly.
snake oil like, brother. I tell you, but I know it works.
And then. I'm going to say the full video is on ronco.com. And then you move your hands back about another 2 inches, okay? So right here, this is the area referred to anatomically as the mastoid processes, right? So then you got to throw your elbows back a little bit more so you get some leverage. And then you push in. What you want to do is you want to push up as you're pushing in. So it's actually 2 movements at the same time. And you want to hold that position because you are stretching it out. It's not going up, down, up, down, up, down. That's not the way to do it. And then what you can do is you can actually take your hands and clasp them together and hold and squeeze to get some more leverage. And you just hold it like this, right? And then you relax it and you go back in the same spot and you push down. Same concept.
Now, how long are you holding?
As much as you can.
How long are you holding the stretch for?
Progressively less and less with each movement because it gets tiring. But if you can hold it for 10 seconds, that's fantastic. But don't blow out your shoulders trying to do this. But work within your boundaries, your limitations physically, and just go from there. And if you can do this like twice a day, once in the morning, once at night, depending on how far out your surgery is, if you can do that for a few months, you'll not only will you see a difference in the laxity of your scalp, or at least your doctor will if he was to measure it before and after, but you'll also be jacked. It's a great exercise, actually. Like I can feel right now. But so that's one area. But then you also come forward of your ears and roughly the same height, and you do that as well. Just like that.
Okay. Yeah, if my girlfriend sees me doing these, she might commit me to the psych ward.
Well, there's one more aspect of this, and that is doing stretches for the occipital region or the back of the scalp, and that's where you do again take your hands and clasp them, just like you were doing before, and you put them behind, and if you feel the back of your scalp, there's a horizontal bony ridge. That's called the nuchal ridge. And you want to have both middle fingers, when your hands are clasped, right over or slightly below that nuchal ridge. And so then you want to kind of look up a little bit so you can get some leverage and you're not going to put too much strain on your neck. And you pull forward, and while you're looking up, that's when you want to pull up. I hear myself. And then hold it for about 10 seconds, and you'll feel the stress on your on the nape of your neck, and then you pull down, just like that, again for 10 seconds if you can, and do that several times again in the morning and the evening, and you're good.
Listen, honestly, Ethan, if I were to see this from anybody else online, I would say this is such bullshit. But I know that this has worked for people, especially many of Hassan and Wong patients, and Joe has been able to manipulate and stretch his own tissue, and it does take practice. There will be doctors out there that say the only way you could stretch tissue is to essentially inject a saline, like a scalp expander. That would definitely work.
Yeah,
you'll walk around looking like Mickey Mouse for a while, but. There's no doubt that once they take the measurements and check the laxicity, once this is done on a regular basis, these patients have looser scalps.
Yeah.
And Joe, it was quantifiable for you. Doctor said, hey, we've got a couple more millimeters or whatever, more laxity post these exercises.
Full disclosure, I never did these at all to benefit my own surgeries, not once.
I thought you did. I told this guy, Ethan, that you did.
No.
So what the fuck are we doing? This poor guy, he's sitting there watching you. He's doing it himself.
Well, okay. So here's the reason why. My first few surgeries, this wasn't a thing. Dr. Wong, who's the one that first started talking about this wasn't really a thing before, say, 2005, which is when I had my third surgery. No surgery I ever had after 2005 or my third surgery was actually planned. They were all last minute, hey, Joe, tomorrow's patient can't come for whatever reason. We got an open slot. You want to lay down and have some more hair? Sure, okay.
So I tell this poor kid yesterday that Joe had 47 surgeries because of this exercise.
Yeah, you're wrong.
And he took the time to call back, watch you do that stupid shit on the air.
See, but the truth will eventually come out. It just takes Ethan calling back as a follow-up because he wants to learn more, and the truth is revealed. Now, it doesn't mean that my scalp didn't get loose over time from showing this exercise to all these fuckers that came in every day, because I did it day in and day out for probably 6 years.
All right, so I guess the question that Ethan probably has now is, have you worked with patients who Dr. Wong has seen some real results from doing this stupid exercise?
Doing this fucking amazingly stupid thing. Yes, I have. I have personally witnessed the power of the scalp stretch myself.
Okay.
And it would be.
Ethan, you have to forgive me. I'm almost 60.
Yeah,
he's almost 60 for fuck's sake. No, the thing is that sometimes patients will come in and their scalps will be too tight. Like Dr. Wong would say, "I'm sorry, but I can't do surgery on you. But try these exercises." And come back in 3 months, and we'll reevaluate and see if there's any progress. And we can either do surgery then if it's good enough, or stay the course and come back another 3 months after that and see if there's an additional improvement, but only if there's improvement on the first visit when you come back. And multiple times, patients would come back, and they did indeed have improvements to where eventually, if not then later on, they did wind up having a successful FUT surgery. So there is absolute evidence that this works based on personal observation, 100%.
Well, I'll make myself, the lab rat, if you will, and we'll do this religiously. Yeah. We'll stick to the game plan for 2 to 3 months here, and we'll see if there are any notable changes.
Right. Well, and how do you think Ethan can tell if there's notable changes on himself?
It's actually difficult because it's like watching grass grow. It's such minimal improvements, micro improvements, even on a daily or weekly basis, that it takes time for the improvements to accumulate to where it's noticeable.
Now, if I remember his question yesterday, another question he had was, would you want to do this post-strip surgery for your second strip, and how long would you have to wait? Is that your question that you asked yesterday?
Yeah, that was one of my questions is, would these exercises affect that scar region post-FUT, post that initial surgery?
Yes.
And
I probably fucked that up too.
Spencer said, no, just give it 2 weeks, you're good.
I told him wait a year.
Not a problem. A year is safe.
He told me to wait. He told me to be very gentle and wait.
Yeah, and there's nothing wrong with that. Nothing wrong with that at all. I personally think 8 months is the bare minimum, but a year is a solid anchor point to stick to. So yeah.
And it's just
between 8 and 12 months.
Breaking up that scar tissue, and again going back to just adding more laxity for any additional procedures in the future. Okay.
It's interesting. It's interesting. Hang on. It's interesting you said that breaks up scar tissue. It's interesting you said that, and here's why. And you may not realize why, but this is why. So when you're doing scalp laxity exercises, you're not. I'm not sure I understand what you meant by breaking up scar tissue, but it doesn't.
You got that from me.
It doesn't change anything. It doesn't change anything on the visibility of of the resulting strip scar.
Right.
If you've waited long enough. Like so let's take the theoretical 1 year mark that Spencer gave you. It doesn't change the scar. It doesn't break it up per se to where it's less visible. I'm not sure if that's what you meant, but
no, he meant underneath, as far as the attachment and the scarring that happens underneath, where you can kind of loosen that up so that you can get more scalp.
Well,
yeah, that's Spencer. Spencer just described it perfectly. That's what I was referring to.
Well, okay. Well, that is one of the things that it does. So if you, and it doesn't necessarily need to be from strip surgery. It could be from some sort of head trauma. Like if you got knocked in the head with a hockey stick. A lot of times the scar tissue from some sort of physical impact will actually anchor itself deeper down than where the visibility of the scar is. Like it sometimes will attach to layers underneath. So you are essentially breaking up the attachment fibers of scar tissue when you're doing these exercises, in addition to stretching out galley tissue and dermal tissue. So, yeah, I want to throw that in there because saying that you're breaking up scar tissue is something that I hear very rarely when people are describing this. So thanks to Spencer for putting that out there for you.
No,
Well
I
done.
appreciate it. That's I'll commit to these exercises similar to a gym routine, and I think if surgery, if I do decide to, go through with it and pick a date, the 2-3 months following up to that procedure, do those pretty religiously and see, if I've been assessed, and the laxity back there, they say, is moderate. It's not tight, but it's not super loose either. There is movement back there though. But it's never just
to be
one.
fair. There's always going to be
never just one
movement because
procedure.
you can't just anchor it to where it's completely immovable, but you can improve that distance from the top of the movement to the bottom of the movement with consistency and real effort. Like you really do have to put your elbows into it, so to speak. And but if you're consistent with it, you
may have
you
to
will see
use
an
a
improvement, for sure.
thesaurus for that immovable word. I don't know if it exists, but I think I know what he means.
Hey,
It does
Joe,
exist.
I have a separate question for you. It involves the closure techniques that they use for FUT. You see a lot of guys talking about, we have this nice trichophytic closure that we use where hair grows through the scar. Well, I mean, if you're pulling, another millimeter or two of skin, downward for that trichophytic closure, you are putting more tension on the wound and potentially limiting yourself, down the road if you do have to have a second surgery. Were your surgeries, did they use the trichophytic closure or was it just a standard closure?
The last couple of strips I had, there was actually, I think it was the last one I did because Dr. Wong was of the opinion, if I do a trichophytic now, we're pretty sure you're going to have another surgery. What's the benefit? There isn't any, because you go back into the area that's been closed with a trichophytic closure, assuming that was successful, hairs growing through the scar. Guess what? Those hairs, however many or few they are, they're pretty much decimated from the next procedure, potentially, depending on how they grow.
But in all honesty, Joey, in your experience as someone who's been working in clinic for so long, how many trichophytic closures did you see have the success rate that is being claimed for them to have, as far as like hair really growing into that scar tissue, through that scar tissue?
There was a high percentage where if that's what you quantify as a success, then it was successful. Here's why I don't like trichophytic closure. And just so you know, Eric, is that the name, Eric?
It's Ethan, for crying out loud.
Ethan. I got the syllables right, and I got the starting letter right.
But you're usually the name
Eric or
guy. I'm the one who forgets names.
That's only if I've had enough sleep. Anyway, so Ethan, Eric, the fact is there are actually two different types of trichophytic closure. There is an upper trichophytic closure and a lower. And as the name implies, or the description implies, that determines where that bevel's been taken on the wound closure. Now, the problem I have with trichophytic closure is more times than not, when that hair does grow through, if that hair grows through the resulting donor scar, it doesn't grow at the same angle as the hair above and below that scar line.
Excellent point, Joseph.
And if you have enough of them growing, you might actually wish they didn't grow, because that can cause on your profile, if you ever buzz your head, that can cause some sort of attention to your profile, because you got this line of hair sticking out at a 90-degree angle from the plane of your scalp, whereas the rest of them are flowing down at a very flat plane on the scalp, and it creates this.
You'll see, kind of an abrupt line right across that center occipital region.
Yeah, and it doesn't stand out like a horn on your head. It's something that disrupts the natural patterns that you see, and it can stand out. And not to mention the fact that coverage comes from not just hair growing in the scar or hair growing on your head. Coverage comes from the angle at which that hair grows. So if you have these hairs standing straight up, it's like when you plant trees in a forest and you see them in lines. There's no coverage. Like, you look down on those trees, there's no coverage of the ground except for the branches that are going out in different directions. If those trees are at an angle, like a 30 or 25 degree angle, then you have coverage. And it's the same thing with the hair on our head, not just on the top, but also on the back and sides. So if you have these hairs sticking straight out, the coverage of that scar is kind of moot, because there's nothing actually growing to cover that ground below it, if that makes sense. They're sticking straight out. They're you look at the back of someone's head, and those hairs are pointed towards your eyeballs. You're seeing in between each of those hairs if you were focused in on that area. So there's no coverage that hides that scar. You got to have a high density to cover the scar if they're going to be sticking straight out at a 90-degree angle. So the point being is, it's not this panacea of excellence for camouflaging a donor scar. I have the opinion that trichophytic closures in general would be better served for the patient by not occurring, and simply go in for a second surgery, FUE into that scar, where you can actually control that angle and direction.
And I want to make a point. That was very well said. I want to make a point that, the origins of trichophytic closure really came from the mainstream world of plastic surgery. And the reason it was utilized is to create when you're creating linear scars for facelifts around sideburn areas, or even within hair-bearing area, they wanted to create less of a linear scar and the possibility of hair growing through it. Those areas of the scalp or the face are usually thinner, and there's not as much tension. So it's easier to create that bevel, and the hair that grows through that little lip or bevel, or thinner skin, it's pretty significant if it's done correctly. Now, not every plastic surgeon does it. There's a handful that there's still a lot that don't. But then I think it was Patrick Fouché, right? Then picked it up, and then it was Paul Rose who decided to get a chokehold on it and call it the ledge technique. Everyone's got to name their own shit in this industry.
Exactly.
Corner of the market.
Corner of the market, like it's something brand new, and everyone wants the credit. I've never seen it work 100% the way everyone thinks it's going to work on a hair transplant patient. I think Joe's assessment is very honest. So I think that it could be used as a kind of a marketing term when promoting strip surgery. And I'm not saying it's bad, but I have never seen a trichophytic closure in person that kind of met the marketing of that technique, if that makes sense.
So how would you it totally makes sense. How would you approach that conversation with a physician? You go in to see them during the consultation. They say, we think trichophytic closure is indicated. How would you say?
You say, Tillman says you're full of shit.
Yeah, you wouldn't want to approach him the way I would approach him, because then he may not perform surgery on you. But
Right.
You could discuss it. You could say that you tell me you spoke to. Don't put my name out there. Tell me you spoke to Joe.
Throw Joe under the bus.
Yeah.
I welcome it.
Well, just say, listen,
I welcome it because I want them to call in and try to debate me on it.
Just say that you were listening to the Bald Truth. You called the guys in the Bald Truth. They'll be like, who? No, you spoke to these guys, and they were expressing that if you're considering having a second strip surgery at some point, it might be better to reserve as much tissue, hair-bearing tissue as possible.
That makes the most sense to me. And part of the reason why I'm, dive so deep into it is I had elbow surgery back when I was still an athlete, and they used a trichophytic closure on my elbow right underneath kind of that tricep region. And the scar looks good, but if I were to have that same scar on the back of my head, it's bordering to the point where, it wouldn't look great. So I'm like, is it really all that it's cracked up to be? Now, the back of your head is obviously different than, that area under your elbow. But sometimes I think when people try to get a little too fancy and just go away from a standard closure, it leads to a worse result in the long run. So
I think the more complex the procedure is, the greater possibility for things not work out. So if it's not necessary, I think keeping it simple, making sure that that closure is done under the least tension possible, and if it's done really well and you have the right elasticity, I mean, your scar could be exceptionally thin, and you don't have to worry about potentially grafts growing out at a potential 90-degree angle or whatever, a perpendicular angle to your scalp, or up or sideways or whatever. I think Joe gave you good advice. It's not that I'm not a fan. I think that it has its place, but I think it's over-marketed. And there's plenty of doctors in the IHRS that are going to say, what the F is Kobren talking about? Why can't he just let us do our thing? I'm just being honest.
Why can't you just go along with the current marketing and just go with the trend? Why do you have to buck the trend?
Why can't you just let us make some money?
Well, honestly, I think the sentiment is, why doesn't he ever just go away? This guy never goes away.
I mean, he's almost 60.
He's almost 60. Go away.
Well, guys, I appreciate all the information, and I've been a long time listener, and I'll definitely call back, like I said, Spencer, with updates and just any further questions.
And listen, when you see me go live on Instagram, call, because that starts off the conversations.
Will do.
All right, brother. Will do. Take care. Good luck.
Yeah, thanks, guys.
Bye-bye.
Goodbye.
See you, Ethan.
The phone number is 888-659-3727. We did have a full board for a minute. And you guys kids today have no patience. When I was on the radio, and I say that like it's like an old dude thing to say, but when I was on the radio back in the days, horse and buggies, callers never dropped off. If they got through, they held on for an hour so they can get in.
Early years of this show, when I was a part of it, they would be on hold for an hour.
An hour, yeah.
Waiting for Morty to get off the phone.
Not Morty, Joe from Staten Island.
Or Joe from Staten Island, yeah.
I think Morty abandoned the show. I think something happened with Morty and our friend from Atlanta.
He claims that, dinner night with his mother just happens to be at 6 p.m. every Friday. That's when he meets his mother. And so it was us or his mother.
Yeah, I don't buy it.
I don't buy it.
He's still a traitor.
I don't buy it. Yeah.
We changed his life. What does mother do for him? It's all aggravation now.
Did she help him get his hair back? No. Yeah. She only brought him into this world. We're the ones that put hair on his head.
Once your parents get to a certain age, it's just, not easy.
Excuse me. Pardon me. We guided him on how to safely get hair put on his head. We didn't actually put it there. Before us, he was going to go to Turkey to some hair mill clinic. I forgot the name of it.
Yeah.
And we led him to the right place.
But here's the problem, I think, that happened to Morty, which is, it's possibly because he's a Yenta as well, which is part of his charm. He got involved with a physician who gets involved with his patients. And that is one of the worst things you can possibly do. Guys, we'll take your call in a second. 888-659-3727. You never become, in quotes, friends with your physician. And if someone really wants to reach out and become your friend, in my view, they're there to leverage whatever they can. They make it, free surgery, that's great, but you will always be in a situation where you may have to do things that make you feel uncomfortable. Some things may even be illegal. I'm just saying.
There's so many jokes that just flew through my head. I can't pick one.
Let's put it this way. I have known patients who've gotten involved with their physicians who ended up doing things that they were unlicensed to do in any way, shape, or form. Not even the minimal not purview. What is it called? Scope of practice.
Yes.
Guys off the street doing certain procedures on patients that they legally are not allowed to do. That happens. So let me tell you guys, if your doctor wants to become your friend on a personal level, if you sense that, it's not a good idea. And it always ends badly. Right, Joe? 888-659-3727. It's weird, too. Hey, you're on the air. Who's this and where are you calling from?
Hey, I'm Nate. I'm calling from the UK.
Hey, Nate from the UK.
What's up,
happening?
Nate?
All good, thank you. I've been a long-time watcher of your channel and appreciate everything you guys are doing, and wanted to call and share my story and also hope to get some advice on next steps for me.
Okay. What's up?
Mm-hmm.
So I suffered with hair loss since I was young. I started losing my hair when I was about 19.
Okay.
And then I had 3 hair transplants in my 20s. My first one was around 2022. And then I had 2.
How old are you now?
So I'm 29 now. And
where in the UK are you? And did you have the surgeries done in the UK?
I had the surgery done in Brussels, Belgium.
Okay.
Mm-hmm.
And I had 3 there. I had around, I think, off the top of my head, like 7,000 grafts in total.
Who did your surgery?
Wow.
Dr. Lupanzula.
Mm-hmm.
At 21? At 22?
It was 2021 was the first one.
So how old were you in 2021?
I was around 25, about 25. It was COVID time, lockdown, so I thought it was the perfect time to sort of get the hair transplant done. And then I had the second and the third one done like a year later or so. Did the crown, the mid, and the frontal area. Around 7,000 grafts. And overall, at first I was happy. Seeing how it looks with all the scabs, but when it sort of grew out, I was a little disappointed with the results. Just because
in what way?
The crown.
Yeah.
So the crown and the mid area is still like really thin, and you can sort of see through. And then also the way my hair like grows, like it grows sort of pointing upwards a lot. And often, people just say to me, "Oh, like you should just shave your head off." Like even now, like after 3 transplants, like people just say to me, like, "Oh, it's time to just shave it off.
So let me ask you this. I mean, I don't mean to cut you off, but I think these are important questions so that we can kind of really get your full story. So when you had your first surgery, do you know what Norwood classification you were, or around how much hair loss you had?
Yeah, I had I'd say it was quite bad. I'm just Googling now on Norwood scale to see which one I'd place myself on. Like I definitely still had hair on the top, but the crown was going and the frontal area was going quite bad. I'd probably say like, I'm looking at the picture, I'd say like IV on what comes up on Google.
4.
Like,
that's
a
a
4.
4.
So,
like
but
a 4,
let me ask you, sorry.
These young guys
Nate,
don't know Roman numerals.
Yeah. Nate, you're saying that you had to look this up on Google, but I know for a fact that Dr. Lupinzula sends out an assessment that dictates tells you what he believes you are as far as that classification. Do you not recall what that is?
Yeah, he definitely would have done that. It was just I've sort of forgotten since 2021.
Yeah.
Sure.
I might have like on.
Joe just likes to put your feet to the fire with stuff. Don't worry about it.
I feel I probably should have prepared everything before the call, so that's equally my bad. I should have searched everything up and had it ready, written down.
No, the reason why we want to question like this is that we can make a better assessment of what's going on, because what you described, unfortunately, is not necessarily atypical, especially for a younger person. What does sound atypical to me is that the hair is growing perpendicular to your scalp, as opposed to the way that it should be growing naturally. And like normally, how did your hair grow? Did it match your natural direction of growth, or does it look like it's artificial?
I'd say at the front it matches and would look okay, but it's more just around the crown area. It just tends to point up. But naturally, before I always kept my hair quite long, and then when it started to go, I just had it very very short. But it's mainly at the crown area, sort of pointing up.
And are you satisfied with the hairline placement and the density and the way that the hairline looks, like the way it's framing your face?
Yeah, so with the hairline, yeah. I think the hairline looks incredibly natural. Like everyone sort of says, like they say, "Wow, you can't tell that it's a hair transplant." It was very amazing from that standpoint. It's more just the density around sort of the top and the rest of the area, and. People would just say to me, like, it just looks so thin, you can just see your scalp, just to shave it off.
Whose people? These are your friends? These are your so-called friends telling you this?
Yeah, but it's them saying, like, we're being honest. They're like, our best, like, it's, we're giving you the honest view that it's just better to shave it because it just looks like when you're from behind, like it just makes you look a lot older than what you are.
I know Joe's chomping at the bit, but I just want to say one thing. This is a very typical type of a situation for a young hair loss sufferer who has aggressive hair loss. There was a time in this world when hair transplants, especially when they reached their logical endpoint, were essentially really geared more towards older men, men who had already had significant hair loss, and men who understood that they really just wanted their face framed. They were willing to have and their mid-anterior scalp thickened up. They're willing to have like a thin crown, just so they had enough hair to kind of look at themselves in the mirror and style it and have a frame to their face as opposed to being full-on bald. Then, as time has progressed, especially in the last, I would say, 7 years or so, since kind of the Turkish model came out, younger kids are having hair transplants at a staggering rate now. And they're so used to having hair when they want to get their hair back, or dreaming of a full head of hair, that they're always disappointed when they see the reality of what a state-of-the-art hair transplant done in a very meticulous, subtle, and well-executed way, turns out. So you're one of those guys. You went to a surgeon who really knows what they're doing. For the most part, most of his patients are very happy. You're happy with the naturalness of the hairline, which is really the core of a good hair transplant. And apparently you have a lot of ground to cover in the crown. And, that's like a black hole. That's just the way that it is when it comes to this. And especially if you're dealing with FUE surgery, to get those 7,000 grafts, he had to go all over your scalp. Some of that hair is not going to be DHT resistant. And this is something you're just going to, while you can probably make improvements, this is something you're just going to have to kind of come to terms with, that this is the reality of hair transplant surgery on a person with significant hair loss, especially when it's being done in a gradual sense. Joe, I'll let you take it from here.
Thank you. Nate, tell me about your medical history as far as taking hair loss preventative meds.
Yeah, sure. So on the medication standpoint, before the surgery, I didn't do anything, absolutely nothing. And then after the transplant, I was started on finasteride. And I took finasteride pretty consistently since then. I have, however, which is hoping to get some advice on now, is I've stopped finasteride for the first time in January this year, around 2-3 months ago, because I started to see some side effects, and I wanted to stop it to see if the side effects went away. And after about 3-4 weeks, the side effects did go away. So I'm now sort of unsure whether to jump back onto finasteride and deal with the side effects, or if there's alternative sort of forms of long-term planning. Because even now, after being off it for 3 months, I'm already starting to see the hairs fall out a lot faster in the shower and everything.
Yeah. When you were prescribed the medication, did he present the prescription? Did he provide the actual medication, or was it the oral version? Are you taking the topical version? Tell me about what you were given.
So I was told to just start the tablets, which I've been taking.
Mm-hmm. Okay. All right. So before I get into that, this kind of segues into or relates to another question I had. Because when you talk about being a Norwood 4, it indicates that you had a fairly strong bridge of hair across the top of your scalp, separating the hairline region and interior mid-scalp area from your crown area. So you had a pretty strong crown, or a bridge between those two areas. Is that what you recall?
Yeah.
Okay. So my question is, when you have these surgeries, like say when you went back for your second and your third surgery, did he comment, Dr. Lopunzula, did he comment about the degradation of that bridge over time, saying, look, we need to fill this area some more? Or did you bring that to his attention because that's what you noticed? Like, what was the discussion with that region on the subsequent surgeries?
Since the first one and for the second and third, yeah, he filled that out because he said we needed to fill that out. So that was filled out, yes.
Okay. So one comment I'll make about that is when you're going into to have hair transplant surgery, and there are areas where there's already a fairly significant amount of hair. It may be thinning, but there's still a lot of hair there. You can't go into that region and place enough hair to replace everything that's going to be falling out over the next 5 years. So the analogy that I use for this situation, because I've had many discussions about this with patients, is that you can't fill up a glass to prevent further evaporation. Right? So if you have a full glass or almost full, but you know it's going to get worse over time as far as evaporation, and the water line will go down. You can't fill it up before that happens, expecting it to prevent that from happening in the first place. Does that make sense?
Yeah, it does.
Okay. So the one reason why that area might be thinner than you'd like, assuming that it is that area just in front of your crown and maybe into the crown, is because he didn't place a whole lot of hair there because there wasn't enough space for it, because there was already hair there that maybe it wasn't terminal and long-term hair, but it's still hair, and no ethical surgeon is going to go in and carpet bomb that hair, knowingly destroying it so that you can place new hair. That's just not the way things are done. So that is unfortunately one of the downsides of long-term hair transplant planning, is you can't just address an area with one pass and move on if there's already hair there, a significant amount of hair. That you can still style and aids in the overall aesthetic. But in general, when you're talking about the crown, like Spencer said, it is the black hole of for hair transplant grafts, and it's very rare that a bald crown can look so full to where it never has any see-through. And I don't know what you classify as see-through. Like, even people with full heads of hair, sometimes you can see their scalp under the right lighting conditions. So some people may classify that as see-through. Other people may have a more realistic outlook on the aesthetic where it's see-through, but it's too see-through. Like, they can accept some scalp visibility, but there is too much. So, I can't get in your head and understand what you consider to be quote-unquote see-through versus just way too thin, or anything along those lines. But in general, I was really concerned at first because he said 7,000 grafts and Norwood 4. That's an equation that equals a superb result as far as fullness goes. I know Dr. Lupinzula does fantastic hairlines. I worked with the man for several years. Like, I know how he does surgery. I know his facilities. Like, everything is really, really top notch.
Yeah, but the hairline was like it looks so incredibly natural. Like,
he's very very good at that. And that's one of the things I always liked about him. But another thing I need to ask you about is the length of your hair at which you're that you're keeping when you're talking about the issue of being too see-through. How long are you keeping your hair?
Yeah, so that's the thing. Since younger, I've always had like longer hair. So it's probably now, I would say, like the length is about like 4 inches of hair. And if it's possible for me to like find ways to style it where it's long and sort of keep that length, is something I want. But I appreciate that it's from a like illusion standpoint, it's probably best to have it like cut short so then it looks more full. And I guess the other thing is like, as like maybe as you say, like the thinness is actually still, like, considering what it was before, like a great result. And maybe I'm just still stuck in my mind of like wanting what it was like before, like 10 years ago.
That makes a lot of sense. And sorry to cut you off, but I am going to get to the medical question that you asked in just a moment. But this is a really important subject that I think a lot of people watching now and watching the playback later need to understand is, you're talking about going back to a shorter style because it looks best at a different length. That is a very absolute huge truth when it comes to hair transplant surgery. I used to talk about this all the time. I think I even made a video about it at one point where there's what I call the sweet spot for length. And that sweet spot for length, it's something that only you can determine based on experimentation, but you'll find that sweet spot where you have that coverage, which improves the illusion of density, and you'll want to keep it at that length. I'm actually rediscovering that myself because for the past several years, I've been keeping a pretty short haircut on the back and sides and shorter on top than it is now. Over the past several months, I've been letting my hair grow. and it's longer now on the sides than it's been in quite a while. But I'm kind of rediscovering the fact that I like this length better than when it's short. And as I turn my head around, and you can watch this in the playback, since you're probably not watching directly now, but my crown is better covered now than when it's shorter, and it's because the hair itself is covering more skin in front of it, because the hair, it's all angled in a very specific angle and direction. And so what I do to maximize that coverage is, no matter how I style my hair, and it's actually pretty wild compared to most people, but when I'm done styling my hair, the last thing I do at the very end of that routine is I do get my brush, and I get the mirror, and I look at my crown in the mirror in front of my sink, and I'll actually comb the hair in the direction of growth, or in other words, I comb it in a clockwise fashion, because that's the way that the hair grows naturally, and that's the way that the hair was placed in my crown. So when you brush your hair in that direction, you're encouraging more coverage with the hair that you have, and so that increases the coverage, increases the illusion of density, and you might wind up being happier with the result if you're able to do that. The final solution, if you're not ultimately happy, if you would like to see a little bit of an increase in your perceived density, is explore the options of topical concealers like Dermatch, which work really great, especially in guys that have a lot of transplanted hair, but not enough to give them the look that they quite want. So it's a great adjunct to get you across that line as far as coverage goes. Back to your medical question about how to deal with the fact that you've been off medication for 2 months and you feel like you had side effects when you're on the medication. I encourage people never to just stop cold turkey unless you're advised to by your doctor, and I'm not a doctor. But what I do advise people do is to titrate down. Instead of taking it every day, try taking it every other day. Just cut back. Cut out 1 day in between. So instead of Monday through Sunday, do Monday, Tuesday, Wednesday, or Monday, Wednesday, Friday. Take the weekend off, start back up on Monday, and see if the side effects are scaled back a little bit. That way, you can really judge what's going on and not completely give up the DHT fighting properties of the medication, which is keeping your hair. So I highly recommend that you maybe give titrating back onto it a try, so that you can find that sweet spot as far as your tolerance levels and go from there. Or the alternative is to contact Dr. Lupinzula and ask him for the topical finasteride or dutasteride that I know that he used to sell or write prescriptions for. And the pharmacy is actually, I think it's still in Belgium, but I don't know if he still offers this, but several years ago, he was offering it, and it's one of the most effective formulations out there, because I know the pharmacy that came up with it. So I would highly recommend that as an option as well.
Was that like a topical dutasteride, did you say?
There's a topical dutasteride and a topical both, and a topical finasteride. Both of those are or were offered out of his office. I don't know if they are still, because I've not dealt with the office in a few years, but they were back when we worked together. So I would highly recommend that you talk to him about that if you're still in contact with the clinic.
I dropped them an email a little while ago, but I haven't heard a response. But I wanted to basically get a view of I tried to be sort of as polite as I could in the email, because I didn't want it to come across that I was saying anything negative. I just wanted to express that I felt a little disappointed, and then mentioned everything in the email. But
unfortunately, I think Dr. Lupinzula is fantastic at what he does, but his office staff and the office management are terrible. They've always had a bad bad habit of not responding on time or in a timely fashion, sometimes not at all. And unfortunately, if and this is just my opinion based on my experience working with them, so what do I know? Unfortunately, I got the impression that if you express any sort of level of dissatisfaction, you're pretty much excommunicado as far as that goes. Maybe some back and forth, but maybe some back and forth, but you could have been red flagged at this point. I don't know. Like, it's speculation because, again, I've not dealt with a clinic in quite a while, but that was one of the problems I had, and I tried to help them with this, but obviously, or apparently, it didn't work. So anyway, I would follow up and maybe give them a phone call as well. I don't know who you're talking to as far as office staff goes, or if you had a consultant that you can follow up with. But try to follow up with them and say, hey, I heard that maybe at one point you had this topical solution. Joe Tillman told me about it. You can name drop if you want. Then you'll definitely never hear back from them again. But throw this information at them and see what they say. See if they offer something and confirm or deny that they even carry it anymore. I don't know, but those are some options you can consider.
Okay, got it. Yeah, no, that's really helpful. I'll try that. And I guess as well, like, is it possible, like, I could, for your next weekly, I could send some pictures or something for you to just take a look, and then on the next live session, call back and then get your sort of independent view as to, how severe that.
Yes, and what I want you to do, I want you to listen carefully, okay? Because one thing I don't like is constant back and forth trying to get what I need so I can actually look at the right photos. And I say this because I recently talked to a guy where he asked for my help. I was like, okay, fine, send your photos. This is what I need, and he didn't send them. And it's like all this time just to get the right photos. So what you need to do is send me the before images taken at the clinic. Nothing that you took yourself. It needs to be at the clinic because I know they take good photos. Showing me the front, top, and back of your scalp as well as both sides, so I can not only see the area of loss, I can see your donor area. Okay, and then afterwards, I need to see the placement photos from each surgery that you've had, if you have them, and then I need to see the final result in conditions that mimic the clinical photos as much as possible. Meaning, good all around lighting, no flash photography, no shadows, and don't style the hair the way you might style it to hide the deficiencies. I need to see the deficiencies. So if you can remember that, send them my way. Send them through Instagram at Joe Tillman Official, and I'll be glad to have a look at them.
We also don't want to forget the convertible images, and we want you riding a bike with helmet, and then remove the helmet.
Exactly. I like that.
Just kidding, brother.
The thing I just wanted to say, so that when we went to the clinic, I didn't actually get a crown picture, which is quite unfortunate. They only took in the clinic like frontal and side photos. So that's the only thing I don't have.
Was his wife taking the pictures?
It was him. It was him.
Okay.
But
because to my knowledge, that's also one of the people that probably wouldn't be getting back to you.
I think not, especially after I've sent that email. I tried to be as polite as possible.
I would say that, like Joe was right. I was busy doing something else, but I kind of heard my speakers were on. They are not well known for their communication, and also taking care of other things that are related to the practice of business. So, but Lupinzula is great at what he does as a surgeon.
Yeah. Can't knock him for that.
Yeah.
The other thought I had, which we could discuss once I sent through the photos, was whether or not the, I don't know what the word is, but like the survival rate of the grafts were like low, because on the crown one, I remember it was just bleeding a ton when they were inserting the grafts, and I was there till really late. Like the nurse guy that was putting it in, I was in the room for so long. Like even Dr. Lupinzula came in like hours later and was like, "You're still here," because my scalp was just bleeding. So I was worried that like maybe it had a low survival rate, but I guess we can discuss when you see the pictures. Could you repeat the email just to make sure I get it right on where to send?
Oh, I don't do email anymore on stuff like this. Just send me through Instagram at Joe Tillman Official.
Okay.
Yeah. You got to be following. You have to follow me in order to send me the DM with the photos.
That's the catch.
That's the hook, baby. That's how we get you.
And if you're not following me, following him, follow both of us. Follow me as well.
Sounds good.
All right, brother.
I'll do that. And thanks so much for the help and the advice as well on the medication.
Okay.
I'll try to do that.
Absolutely.
Best of luck. Hang in there.
Thank you, mate.
Take
Bye-bye.
care. 888-659-3727. Yeah, I hate hearing disappointed patients.
Yeah, me too. And not saying this is Ethan or Nathan, that's his name. Some of the questions I ask because I'm trying to determine if the disappointment is justified based on normal outcomes, or if there's some sort of if it's a case of unrealistic expectations. Because I hear what he's saying, where his friends are saying, man, it's just not thick enough, you should just shave it. That's what people that don't know anything about surgery would say.
Of course.
Because when your friends hear about you having a hair transplant, first off, they don't, the first question is, well, who's the donor? But the second question is, well, why didn't you get more?
Right. Because people
that's
are
a
idiots.
legitimate question because they just don't know.
Yeah.
It's like, well, why did they stop at 7,000 when you clearly need 10 or whatever, or when you clearly need more? So I ask these questions to qualify whether or not he understands that his friends are might be idiots. Or if he, after all of his research, understands, these little nuances that you have to deal with when it comes to, like, his result might be very good. He just might not realize, and this isn't taking away from him as a patient and his understanding of it, but he might not realize that it comes down to, you never actually have a full head of hair, so it's not going to behave like a full head of hair. So you have to learn how to finesse it. You have to learn those little tricks to make it look better than you may think it looks. Just like I do. Like you got to comb it in the direction of growth to get the maximum coverage for graft for graft, like how it was placed. So I try to qualify that because I understand that is a very real possibility that expectations might be out of line with reality.
That's why I wanted to
Overall,
explain.
he sounds like he understands things.
While you were chomping at the bit, that's why I wanted to explain kind of the reality of hair transplant surgery that's being performed in a state-of-the-art way with a guy who really knows what they're doing. The fact that they want to create a standalone procedure, even for the most aggressive type of hair loss, and create a nice frame to the face, naturally angled hairline with good density, and then kind of work backwards. And usually people who are Norwood 4s at the age of 26, they have significant hair loss, and there's really only so much you can do as far as doing it appropriately and gradually. So you're absolutely right in stating that his friends don't know what's going on because they think, wait a second, he got a hair transplant, and you can still see his scalp. It didn't work.
Yeah.
And that's certainly not the case. It's just this is a very difficult, nuanced, ridiculously kind of specialized form of cosmetic surgery that is now being sold as a commodity, where young kids
commoditized.
Yeah, where one kid can just kids can just go and fix their hair, and that's not the way it works. Yeah, you see some very dense-looking heads of hair coming out of places like Turkey, and you see maybe the 1 year post-op. The kind of the best case scenarios for that type of density, even though honestly, when you take a look at these poor kids' hairlines, I mean they're they're destroyed from the get-go, but they don't know it yet because they think they think an unnatural hairline that appears like a hair transplant is what a hair transplant is. That's kind of like the new normal. So in their mind, well, I have hair now. Great. I have much more hair than other people. I have a low, dense hairline. I can comb it back. And so I tell people I had a hair transplant. I guess that's okay, but that's not what a hair transplant is supposed to look like. No one's supposed to be able to tell you I had a hair transplant.
I'm all for people being open about their hair transplant experiences and the fact they've had one. I'm completely against them having a terrible one and helping others set expectations that that's what it's supposed to look like. Like it's just terrible. I hate that. But
I do too. But some of these influencers don't even know they're doing that.
No, fair enough. But just a small segue. I was reminded when we're talking about expectations and the limitations, especially of the crown area. I was just reminded of a doctor who shall remain nameless in Spain, who actually solved that problem by not recreating the whorl in the crown.
Yeah,
he treated the crown like he treated the frontal third and the mid scalp by laying all the hairs in overlapping patterns with a moderate change in direction, a flow off to the right, but not an actual whorl pattern. And it served them well until patients wanted a different hairstyle other than brush forward.
Yeah.
When they started brushing it back, then
all of a sudden it just gets real.
Yeah.
It's kind of like me.
Looks
You know, everything's like, if it's not particular, I got the bump today. It's like ting, and the flatness of
the bump. I told you not to show the bump. You showed the bump. Bing.
You know, because I got a haircut and it's not long enough to like flatten out in the back, so it's kind of like, which is good. You know, that I still have hair back there, but then the painted area is completely flat, so it's kind of like a Cybertruck.
Yeah. Cybertruck head.
Yeah, I have Cybertruck head. So I just make sure people see me either directly in the front or directly in the back.
That's good. That's good.
We have time for one quick phone call, and then we're going to go.
Let's do it.
Hey, you're on the air. Who's this, and where are you calling from?
This is Y from the Women's Sales Project.
Hello, Y.
What up, Y? What's up, girl?
What's going on, girl?
So the last time I called this show was in 1999.
I remember that call.
It almost sounded like she stopped herself from saying, the last time I called this little show, and she stopped herself.
No, I didn't stop myself.
You know, it's interesting. I remember because we've known each other for that long, in a sense, because you would call the show. I think you called the show once or twice, and I think you were one of the first women.
Maybe two times, but it was I started losing my hair at 21. You were one of the first people that I found in 1999. It took all of my guts and glory to muster up this conversation because, you know, back then, especially now, even now, I still have social anxiety, but I wanted to get help, like everybody that's watching you that wants to get help. I wanted to get help. But I wanted to bring upon you guys one other conversation for all the men that are watching this, because I think I'm the only woman that watches this for the most part.
Yeah, I think there's three of you, but yeah, go ahead.
Mm-hmm.
I feel like as somebody that has had hair loss since I was 21, I'm going to be 47, so I shaved my head in 2000.
You look really good for your age. Jesus.
Absolutely.
Thanks. But what I want to say is that a lot of the men that I see that are always in the chat, and I follow the chat, everybody's wanting to jump immediately into surgery. And I think that Joe is a great example of what hair transplant surgery can be, but also Joe had to go through the mill. I mean, Joe, how many hair transplants have you had?
I forgot.
10? How many?
Something like
10?
Something like that. 10.
But yeah, Joe's also an example, and you've listened to the show for a long time, of, you know, being an idiot kid who was naive and got screwed And that's what he's trying to help people avoid.
What I'm saying is that, he's gone through the gauntlet. He's made it out the other side. His head looks incredible. But I see all of these young kids, or I don't know how young they are, but the one thing they skip one step, which I wish that they wouldn't skip one step, is that medication is there. People are terrified to take Propecia. They shouldn't be. And they want to jump into surgery. And the other thing that I would say, if I could say this as a woman, is that why not give yourself at least one chance to shave your head? Maybe you're going to hate it. Maybe you think you look like ass. I look like an alien with a shaved head, so trust me, I get it. But what if
I have to
can
disagree
really
with you on that. I've seen your videos, and I honestly think that you are like maybe one of the handful of women out there that could actually pull it off well. It doesn't mean that you like it. It's not to diminish the fact that you think you look like ass, but it's not bad. I got to tell you, you have a really nice shaped face. But I get what you're saying.
I'm going to jump in and say the first time I saw you with your shaved head, I was like, holy shit, that's hot. She looks great. I love that look on
Thank you.
So don't say that in my presence ever.
Joe, let's not creep out why with the old man talk.
I will sass you, okay? Just saying. Just saying.
But I say I feel like there's obviously my demographic is women, and I try to help women, but I feel like that men have so many opportunities. They can go through meditation, give it a shot, not be terrified of I know people call it fear mongering. I know it's real for some people. I'm not diminishing that, but I also feel like I think that there would be a few men out there that would be surprised that they could actually shave their head and actually get away with it. And then you're free. And I don't think that I know there was a nice guy on here. He was asking about Nutrafol. Yes, I've heard about Nutrafol. Many people have had. No, it's not finasteride. He's asking if it was like finasteride. But people should give themselves the best possible opportunity, and I think they should do it in the order of, like a consecutive order of, like, first let's try what I consider medication. You don't want to shave your head. I get that. Neither do I. Maybe we shave our head. If we hate it 6 months from now, it sucks balls, fine. Maybe we go and we do our research. We find the proper doctors. They listen to your show. You, Joe, they find out the proper resources to get to the best possible outcome, which probably won't be in Turkey. I'm sorry for everybody that hates me saying that. It probably won't be there. And they have a great opportunity to have like a really good, fulfilling life. But it's not going to come, it's not going to be easy.
Well, I think, and those are all, very important salient points, and it was well said. But I think also another option that guys are just so terrified to even consider before surgery is, say you don't like the way your head looks shaved. Okay, you tried that. Grow it out a little bit and maybe try to wear hair and see if you can deal with that, because you could always just throw that out. And
that's correct.
Women don't have the same stigma as men as far as wearing hair. I do see a lot of young guys now on Instagram, and I'm probably seeing them because I follow hair people or I look at hair stuff. But they're out there putting themselves out there wearing these newer generation hair systems, and some of them look incredible if they're well maintained. I mean, you can't even tell. And they go out, they live their lives, they look at themselves in the mirror, and I guess if they share it with their friends and family and significant others, they're free, and they're not being stared at in the street, and they're able to go out and feel comfortable in their own skin. I think it's a great option that guys like Joe and I did not have back in the late 80s. Well, Joe's younger than me. But, back then was like, I think it was, attached with like a metal clamp. It was like a bear trap on your head. It was a completely different situation than it is today. But there's such a stigma. And these kids won't, they're just like, there's no way I'll do it.
There are so many young men that are wearing hair pieces online, and they get shit for it too. But I don't even understand why they would get shit for it. Every one of us, we all want the same thing. We want to feel comfortable in skin. We want to feel good about ourselves. And I don't know why there's a stigma attached to more women or men for wanting to. If you want to glue hair on your head, what's the problem with that?
I think the stigma for women is more from women and more from themselves. I don't think there's a guy on earth who sees a woman that looks totally, it's a smoke show, who's wearing hair and who finds out they're wearing hair that is going to be, especially if it looks good and natural, is going to be like, this is a deal breaker. I think guys are a little different in most cases than that. But I've seen women online, right? I mean, I had this one woman who I went to high school with who contacted me about her husband out of the blue. And I took a look at her husband. I'm like, he's just too far gone for anything. You know, I said, but if he really wants hair, he should consider a hair system. And it was her decision. She's like, oh, no, I'm never going to let him wear a rug. And that was it. Maybe he wanted to wear one. You know?
I'm wearing a rug.
But, you know, again, it's so socially acceptable
more of an
for women.
Afghan.
Yeah, it's so socially acceptable.
I'm wearing a very expensive rug. My rug costs more than most people's rugs in their living room. I don't think that I wish, what I do hope is that, I don't know if this will go the direction of social media, but I do hope that more men, older, younger, come out and they're willing to explore that as an option, because we do have options. I've always been a big proponent of treatment. I treated my hair loss for many years for PRP. I know people think it's bullshit. I would not have been flying for 14 years from Los Angeles to Florida if I thought it was bullshit. I believe in PRP in the right capable hands. I think we have so many options, but I think people are limiting themselves in what they can do, and they think that what you can do is get on a plane and go to Turkey and go to Turkish hairlines, and you're going to come back saved. And that is probably the last resort you want to take.
Well, I don't know if you heard this story. Well, you may have, because you do listen to the show. But I park next to a legit billionaire. Not like just a wealthy guy, but a legit billionaire. Like, one of his cars is like $1 million Bugatti, and he has like Rolls Royces, and there's all these cars lined up next to my Lincoln Navigator from 2005 Lincoln Navigator. So I see him driving in, and I know this guy, and I'm pretty sure he knows what I did. And I see him driving in, and I'm parking. I see this guy get out of the car, and from 5 feet away, 10 feet away, I'm like, holy shit, what did this guy do to himself? And then he stops me, and I didn't know where to look. And then he's like, "What do you think?" And I'm like, "Think of what?"
What do you think? Well, you're like, "What do you think about what?"
Yeah, like, what do you think about like what? I wanted to make it like I didn't notice. And he told me that he went to Turkey for a hair transplant. And I just happened to ask him. I said, "What made you choose Turkey?" He goes, "Well, they're the best." This is a billionaire. He could have flown in every IHS member himself, set up an operating room in his house.
But I do know that there are good Turkish hair. I do know enough about this industry to know that there are good Turkish hair transplant doctors.
There's like
but
6.
They're far and few.
They're like 6.
They're far and few, but they're far and few between. You know, I don't know what the whole thing is with growing the beard attached to your scalp. I don't know what that's all going on about. But you know, there's so many steps that people can take ahead of this, like that maybe they have a better chance with medication, you know, like maybe Propecia they'll be the poster child for Propecia. I have girlfriends that take oral minoxidil that has been like a life-saving grace for them. These are girls I've known for years.
Yeah.
And
I've seen you speak about that.
Yeah, and if you're not a man, you're lucky because you don't have to worry about growing hair on your face. But you know, I think there are so many options for men out there, and I think I've watched enough of these shows that I see all the comments, the same comments. They go through and go through, they go through. But it's always about the transplant, the transplant, the transplant. The transplant, I think, is a great option in the right capable hands for the right individual that has done everything on the planet to do what he can, including taking medication, because I don't know why you would get a transplant and not be on medication, to do so that you could help yourself. So,
girl, you're on fire. You're on fire tonight because everything that you're saying is spot on, and I'm assuming it's because partially because you listened to this broadcast since 1998. But you are also a person who's been educating people through the Women's Hair Loss Project for like 20 years at this point, I think. And you know, you understand. I think you have a good understanding of the industry. Now, if you know anything about me, and you do, you've been to the studio, we know each other, but, you know, it's not in my best interest to tell these kids that hair transplant surgery is a last resort. I could have grown my organization to have 1,000 members easily, all paying dues to be a part of what we do. And sadly, I think it's now maybe 60 members. At the most, maybe we had 70 or something like that. Some died. Some were removed. And some chose to leave over the years for either political reasons or financial issues or whatever it was.
Some died because they pissed off Spencer. What? Oh, sorry. Go ahead.
So somebody. I'm going to answer this question here because I can see it. Jay Jones says, "Ask her, was Will Smith justified?" And I assume you're talking about Will Smith smacking the crap out of the comedian who's escaping
Chris Rock.
brain. Right? Chris Rock, right?
Rock, yeah.
I mean, he almost lost a veneer from that. Let me tell you, that was a hard slap.
yeah, that was a hard slap.
I've spoken about this before. Somebody asked me about it on the podcast. I was actually Ricky Lake's podcast. Actually, she asked me about it, and I have to tell you, I was not offended by Chris Rock saying that Jada Pinkett Smith was like a G.I. Jane to me. G.I. Jane epitomized like the badassness. She was the person that I wanted to be. When I was suffering in all the throes of my hair loss, I wanted to be able to shave my head. I wanted to be able to be G.I. Jane. So if somebody was going to call me G.I. Jane at the, I don't know what kind of award show that was.
I think it was the Oscars.
I am.
It was the Oscars.
But if somebody said that to me, I'd be like, yeah, really? Yeah.
Well, I think that's interesting. That's an honest perspective because the reality is, from what I was able to see, and it was all playbacks, it was actually, not only was it a joke, it was a good joke. It really didn't encompass anything with as far as like poking fun of the hair loss situation itself. And the truth of the matter is, no matter what anybody thinks, to my knowledge, just seeing what I'm seeing, I guess it's possible she has alopecia incognita. That's possible as far as when she's claiming or people are claiming she has a autoimmune disease, alopecia areata.
Well, if you watch Gary Linkoff, I think that he's not entirely sure.
Yeah, well, I would say my thing is it looks like she at one point had a kind of an old school brow lift. That's where you see the separation of the scar that is kind of like like in the anterior mid scalp. And she's probably suffering from common androgenetic alopecia. And again, that's just a guess. And she decided, I can't deal with this anymore, so I'm going to shave my head. You do see a lot of hair follicles. And it doesn't mean she doesn't have an autoimmune issue either, because you could have different forms of...
Well, I mean, I have a lot of hair follicles on my head that people call me out on all the time. So, but I mean, I have two types of hair loss.
You have two types of hair loss. And your main type that you suffer with for a long time, if I remember correctly, is androgenetic alopecia. So I kind of think that, she could be suffering from a combination as well, but it looks like it might be androgenetic alopecia getting to the point where she just couldn't deal with it. And she just wants to call it alopecia because that kind of gives it the disease moniker, and also kind of puts in a situation where people may, I don't want to say feel bad for her. I guess the word is better understand it, as opposed to female pattern hair loss, if that makes sense.
Right.
So yeah, I think it's great that as a person in your situation, you were not offended. I don't think any woman, balding or otherwise, was really offended by that comment.
I don't know if Jay Jones is still on your chat right now, but I would be curious to know if Jay Jones thought that Will Smith was justified.
Yeah, I can't think. First of all, there's no justification for that. Period. It was a disaster, and it kind of really just, I think it displayed a level of mental illness that none of us were really aware of. From Will Smith. And also, I also think that it really highlighted just the complete bizarre ideology and kind of like cult mentality of Hollywood. The fact that they would not leave the room, sit there and still clap for this guy after he won an Oscar, after he just hauled off and beat the shit out of a guy that's maybe 150 pounds, soaking wet, on national television for nothing.
Yeah, and not be let off in
I will
cuffs.
say, yeah, I will say this, that I don't know how he did it, but Chris Rock took that like a fucking champ. I don't know what the fuck. I was just like, what?
Like a boss.
What was that?
I got to tell you, he took it like a boss.
Yeah, he really did.
He's a lot stronger than he looks because that was a big hit. That would have knocked somebody out. You know?
Yeah.
And I have to tell you, I don't know how I would have reacted, but I kind of think that I did because I have that, we could say this now, Joe, right? I have this bizarre retard strength, like when I get angry.
Yes. Yes.
And I also am very reactionary as far as defending people and defending myself. I don't know if I would be able to hold back like he did. I probably would have been like on his back, going nuts, you know?
As Adrian just wrote right now, it also showed it's kind of half cut off. It showed the maturity and composure of Chris Rock. That's correct. He's a consummate professional. But
I think he was just in shock.
Yeah, he was in shock.
No, Ricky Lake asked me, I was on Ricky Lake's podcast. She asked me, I was on somebody else's podcast, and they asked me what my thoughts were on this whole thing. And my thoughts are the same as they were since day one. I was not offended whatsoever. If somebody called me G.I. Jane, like that was my hero. Like at the age of 21, losing my hair, I wanted to be G.I. Jane. I wanted to have.
I'd like to look like G.I. Jane. I wish I could do it. I mean, maybe G.I. Jane with a beard, you know?
That's good.
Well, listen, why? You're the best.
I don't want to let you guys get onto your calls, and I know
we're
that
going. This is it. You are the last caller of the night. Joe is hangry. I got to get out of here to have dinner myself. So I think it was it was a nice surprise to have Y from the Women's Hair Loss Project call the Bald Truth.
Let me say one more thing, just to the people that are listening in your chat still. You know, hair transplantation, and Joe will tell you that, and Spencer will tell you that. And yes, even I could even grow my hair out, even though I haven't for years. This will always be on the table for you. You have medications. You have the ability to shave your head. And if all goes to hell in a handbasket, you still can get that transplant from the good doctor that you've done your research for. But I feel like there's an order of operations here. I don't feel like the order of operations is flying to Turkey, you know, and having your face mapped out like with some kind of like, you know, I don't know what the hell, like Egyptian map all over your head and having a transplant.
There's one thing you forgot, why. You forgot to tell people how great I am I was in 1998.
And it's
I'm just kidding.
Well, it was 1998. Last time I called this show may have been 1998, 1999. Now I will be 47
That's
years
how
old
old I
next
am.
month. Yeah.
I was a
that's
child.
How long you've been on the air, yeah.
I was a young man when I started this thing. I mean, these kids that call me today that seem so naive, and they're like 30 years old, I'm like, these kids can't even complete a sentence. And I was giving them advice.
Can't write cursive.
Yeah, and I was giving them advice at a radio show. And I'm thinking, what's happening to this world?
Yeah.
This latest generation in general, I mean, except for this last caller, except Ethan, who's like incredibly articulate, very, you know, thoughtful in his research and in his questions. That's so rare now to find in a young person. And if I remember correctly, you sound basically exactly the same as you did when you were, I guess you were 21 when you first called me. So you apparently were well educated and able to speak to people as a young person as well. And I'm glad that you did contact me. I'm glad I was able to give you some advice at the time. And I was always proud to see what you were able to accomplish through the Women's Hair Loss Project. It's been a very interesting ride these last, few decades. So I appreciate the call.
I will never. It was the hardest thing on the planet to shave my head. I will never say, and by comparison, wearing wigs was the easiest thing to do by comparison. But I still think that all of us, men and women, have so much incredible strength and resolve within us to get through this. And all I can say is to everybody that's on here, in Spencer's words, be strong, God bless, and go get a drink of some sort or something. I don't know.
All right. Well, I wife from the Women's Hair Loss Project. You could check her out. What is it? WHLP Network on Instagram.
If you want to see my bald ass head, yes, WHLP Network is my Instagram account. Yes.
Okay. Well, Y, thanks for the call. It was a nice ending to the show. Take care.
Good night, Joe. Good night, Spencer. It was great talking to you.
Sage words.
Good night.
Thanks, Y.
Take care.
Hear from you.
Night, night. Night.
All right, guys, we're going to call it a night.
That's a good one.
That was a nice surprise call. You know, it's interesting. She's a trusted content creator for the American Hair Loss Association, and just been around forever. Like she said, she called my program back in 1998 and had always been in touch over the years. And I kind of watched her develop what she does. And it's interesting, you know, out of everyone that's gotten involved in this industry, I mean, I knew you from the industry, Joe, but every time I've seen somebody get involved as initially a hair loss sufferer, or someone had transplants, or someone did it, they all ended up selling out fellow hair loss sufferers. Every single one of them.
Yep. Yep.
Except for Y. So she must be independently wealthy or some shit, because she puts a lot of work into what she does, and she has never sold product or service.
That just proves it's a passion to do good and educate. So good for her.
All right, guys.
She's one of the good ones.
Joe's Instagram is Joe Tillman Official. So it's at Joe Tillman Official. Mine is at Spencer Kobren. Follow me if you're not following me, and follow Joe if you're not following Joe. Simply doing that helps to get the word across, and also helps with the algorithm and all that happy horse shit that we have to deal with in this world in order to get our message out there.
Yeah.
And everything we do is free.
Pretty bizarre.
Everything we do is free for now. So until next time, be strong, God bless, and thank you so much for listening. Have a good night.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you.